My name is Graham Thornicroft, and I want to explain to you some of the work that's recently taken place by the Emerald Consortium across several low and middle income countries to improve mental health care. We live today in a world importantly changed by the United Nations Sustainable Development Goals. These have produced for the first time global targets and global indicators for better mental health across the world. And a project that's been running for the last few years, funded by the European Union, called Emerald, is actively contributing towards this new era. What have we done in Emerald? Well, this is work that's taken place in Ethiopia, in India, Nepal, Nigeria, South Africa and Uganda. And we've done four things. First, we wanted to look at what are the training needs of practitioners, doctors and nurses, but also of policymakers if they seriously want to improve mental health care, and how to establish and how to support service user and family groups in low and in middle income countries. Second, we've looked at what are the costs. Policymakers want to know about money. If you invest a limited amount, on average only $1 per person per year in low income countries, what's the advantage you get in terms of the quality of treatment and the quantity of treatment for people with mental health problems. Next, we've wanted also to look at not making more mental health services, but how to improve mental health care in the general healthcare system, in primary care, in community care, in district care, so-called integrated care across low and middle income countries. We now have very detailed lessons and recommendations about how to establish a proper system to detect and to help people with mental health care in these general and in these primary healthcare systems. But also, many people will say, if you can't measure something, you can't succeed. So we have now established a small number of measures, of indicators of how a health system is working to track progress towards improved mental health. So the central message of the Sustainable Development Goals from the United Nations is leave no one behind. At the moment, we are a long way from that. We know from Emerald data that people with somebody with mental illness in the household less often have meals. Fewer of children in those households go to school. Major impacts of poverty as well as ill health come from mental illness. So the Emerald programme is contributing to strengthening health systems, strengthening mental health in low and in middle incomes worldwide. And you can find these materials on the website. You simply search for Emerald and mental and you will find all of these materials. So I recommend this to you, and I hope this will be of practical interest, but more importantly, of practical use as we work together for better mental health worldwide.